The National Council for Behavioral Health has produced this series of short educational videos for the New York State DSRIP program to assist PPS providers with implementing best practices for integrated care. The following instructional video demonstrates actions you can take to effectively implement a warm handoff with motivational interviewing within an integrated care setting.
So Stephanie, I know we're here today to talk about your high blood pressure. I'd like to hear how it's going and maybe we can make some adjustments to your medications if necessary.
It's getting unmanageable at this point. I'm so frustrated. I don't know what to do and I just need some answers from you guys on how to better manage this.
Okay, so in addition to your medications, which we can make some adjustments to, would you be open to talking to a behavioral health provider about alternative ways to manage your hypertension?
Okay, yeah, that'd be great.
Oftentimes our behavioral and physical health are intertwined, and so Nick, our behavioral health provider, can give you some tips and tricks on how to manage your symptoms and feel better.
Okay, thanks.
Hi Stephanie, my name is Nick, and Dr. Powers let me know that you might be willing to talk with me a little bit today about struggle you're having with hypertension. Is that right?
Right, exactly. It's just getting really frustrating and hard to manage at this point.
So some of the things that impact hypertension, they can be things like diet, they can be things like exercise. Are those any areas that you think you might be willing to talk to me about?
Definitely exercise. I feel like my diet's pretty okay. Well, I'm a vegetarian. Yeah.
So sounds like diet you feel like you have a pretty good handle on, but exercise is something that maybe you'd be interested in increasing?
Well, maybe I could start walking.
You know, the important thing is that we match your exercise plan with your real life. So I know you're busy and you have your family and your job and all the things that you have to do. And the important thing is that we come up with some things that you're interested in that you think you can do that'll be helpful for you to kind of change your lifestyle right now, because that's what we're talking about doing. So what do you think? Are there any days during the week that you think you could commit to, maybe not even running, but maybe we could start with just going out for a good walk?
I could do that probably Tuesdays and Thursdays. I have a block of an hour that I could schedule that for myself.
That's great. That's awesome. So the walk not only could kind of help with, getting some physical exercise, but as you know, the walking might be a great break during your busy work day, right?
Yeah.
Kind of taking care of some stress and tension and kind of getting away from the job a little bit. Would you be willing to kind of set up a plan for me in your chart that we're going to agree that you're going to walk Tuesdays and Thursdays You're going to take a 20-minute walk between 12 o'clock and 1 o'clock.
Yeah, I can do that.
Great. So why don't we set that up, and then you're going to come back in maybe a couple of weeks. Would you be willing to come back and see me?
Yeah, definitely.
This way we can kind of check on, first, how your blood pressure is, and two, to see how the plan's going and if it's working or not.
Yeah, sure.
Because we can always add on to it or build from it, or go back the other way too and decrease it if it seems to be too much. So we'll work together on that.
Okay.
Would that work for you?
Yeah, that sounds good.
Okay, great. All right, well, why don't we go and up to the front desk and I can help set that visit up with you.
Thank you for watching this DSRIP educational video on a warm handoff with motivational interviewing. The flow of a warm handoff will change depending on the providers involved, situation, and patient. We presented one example of what a warm handoff between a primary care provider and a behavioral health provider could look like in an integrated care setting. The behavioral health providers should incorporate the following motivational interviewing techniques. Use reflective listening. Seek to understand your patient's ideas and confirm your understanding with your patient. Ask permission. Ask your patient if they're open to talking with a behavioral health provider. Ask open-ended questions. Avoid yes or no questions to engage your patient in conversation. Enhance motivation. Elicit change talk, which is the patient's desire, ability, reason, and need to change. Determine patient readiness. Determine stage of readiness for change. Negotiate a plan. Negotiate a goal with your patient based on what steps he or she is ready to take. Reflect on change. Summarize what was discussed. Thank you again for watching. Please refer to the following websites for additional information and resources.